What is medical coding? Medical coder reviews the patient's file and translates everything from that file into universal codes required by insurance companies. Medical coding is the transformation of healthcare diagnosis, procedures, medical services, and equipment into universal medical alphanumeric codes. The diagnoses and procedure codes are taken from medical record documentation, such as transcription of physician's notes, laboratory and radiologic results, etc. Accurate medical coding is important for billing and tracking statistics for disease and medical treatment. Conversion of medical records into alphanumeric codes. Without medical coders, doctors, hospitals, and other healthcare providers would not get paid. Medical billers and coders together collect information and documentation, code claims accurately so that physicians get paid in a timely manner. A medical coder is different from a medical biller. A medical biller processes the insurance claims and follows up on them. They do not determine what codes are used in the insurance billing. However, a medical coder and a medical biller can be the same person if they have the proper training. Where can a medical coder work? Medical billing and coding specialists can work not only in hospitals, but also in rehabilitation centers, medical offices, and insurance companies. Medical coders use electronic data today to keep track of patient records easier, but there are still some medical offices that use paper filing. Apart from hospitals, medical coders can build a career in healthcare consulting services. Trained medical coders can access the opportunity to teach and share their knowledge with students. Law firms hire medical coders to investigate fraud claims. Uses of medical coding. Medical codes are the universal language of understanding between payers and providers and hence used for communication and billing purposes. The financial criticality for both payers and providers means that providers have to be compliant and accurate in coding for medical treatment provided. Medical codes are used to analyze statistics patterns in population groups and provide information for national-level health trends. Examples: how many COVID patients admit in hospitals every day? How many bike accidents happened per day? How many patients received chemotherapy last year? Why medical coding is important? Medical history, treatment, medicines, and diagnosis of all the patients should be recorded and accounted. Medical coding ensures appropriate and flawless payment to the physician. Medical coding data helps in designing and planning the projects and schemes associated with the healthcare industry. Medical coding is also a significant factor in obtaining insurance reimbursement as well as maintaining patient records. Steps of claims. 1. Data accessed from patient. 2. Provider creates report of encounter. 3. Biller/coder abstracts procedure and diagnosis codes from report. 4. Biller/coder applies codes in billing software and enters insurance information. 5. Biller/coder preps and submits claim. 6. Biller/coder follows up with payers. 7. Reimbursement collected. Qualities to be a successful medical coder. A keen eye for detail. A small mistake in coding can create large issues. Remain focused as the work is repetitive. Ability to face evolving challenges. Ability to work independently. Medical records. Medical records, health record, medical chart are the document that explains all detail about the patient's history, clinical findings, diagnostic test results, pre- and post-operative care, patient's progress, and medication. If written correctly, notes will support the doctor about the correctness of treatment. A medical record includes a variety of types of notes entered over time by healthcare professionals, recording observations and administration of drugs and therapies, orders for the administration of drugs and therapies, test results, X-rays, reports, etc. Why medical records are important. Monitoring of the actual patient. Medical research. Medical education. For insurance cases, personal injury suits, workmen's compensation case, criminal cases, and will cases. For malpractice suits. For medical audit and statistical studies. Electronic health records. An electronic health record, ER, is an electronic version of a patient's medical history, that is maintained by the provider over time, and may include all of the key administrative clinical data relevant to that person's care under a particular provider, including demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports. Component of medical records. Patient identification, patient registration form. Consent for treatment, evidence of appropriate informed consent. Patient medical history including drug allergies. Medication sheet. Problem list. Physical examination and system review in the encounter. Diagnostic and therapeutic orders. Clinical observations, including progress notes, consultation reports, nursing notes, and entries by specified personnel. Laboratory reports, reports of tests and their results. Reports of procedures and their results. Conclusion if terminating treatment. Condition at discharge, medications prescribed, and any instructions for follow-up care. Immunization records. Arrival time. Mode of transport. Preventive medicine services. Preventive medicine screenings. Invasive procedure consent, if applicable. Medicare lifetime claim authorization, if applicable. Waiver of Medicare liability, if applicable. ABC Hospital. 7G, Rainbow Colony, Anand-Agar 1st Street, Chennai 28. Emergency Department Report. Demographic data. Patient, James Robert A. Dobb, August 3, 1955. Age, 62. Sex, male. MRN, XXX000123. Account, ABC 00012345. Service date, July 12, 2021. Arrival time, 12:10 p.m. Mode of arrive, ambulance. Report type, EdFERPT, Registered Physical Therapist. Report status, signed. Report mnemonic, PHY.ER. Time seen by MD, 12:13 p.m. Chief complaint, alcohol abuse and SI. History of present illness, HPI 62-year male who is obviously quite intoxicated upon exam presenting to the ED with complaints of alcohol abuse and SI. The patient states that he has been drinking over 45-ounce bottles of beer. He states he cannot get up and around due to motivational issues. He reports that he is dying of alcohol poisoning. The patient states that he had SI. He denies any plans but states that he has had previous attempts involving inflicting wounds upon himself with a knife and attempted to overdose on Valium. He denies drug use. Past medical history. Allergies, no known allergies, unverified, September 12, 2020. Home medications. Hydroxyzine 50 mg capsule 1 tab po daily total 30. Aripiprazole 2 mg tablet 1 tab po daily total 30. Past history, HTN. GERD. Past surgery, appendectomy, August 8, 2019. Family history, DM. Social history. Substance, ETOH, alcohol. Marital status, divorced. Travel history, travel and/or hospitalization outside the US in the last 30 days, yes. Review of systems. Constitutional, no symptoms reported. I, no blurred vision, no double vision. And, no symptoms reported. Respiratory, no symptoms reported. Cardiovascular, no symptoms reported. Gastrointestinal, no abdominal pain, no diarrhea, no nausea, no vomiting. GU, no symptoms reported. Musculoskeletal, no back pain. Skin, no symptoms reported. Neurological, no dizziness, no headache. Psychological, alcohol abuse, suicidal ideation. Endocrine, no symptoms reported. Hematologic/lymphatic, no symptoms reported. All other systems reviewed, negative. Physical exam. Vital, temp, 97.3. Pulse, 74. RESP, 18. B/P, 155/94. Pulse ox, 93. O2 delivery, room air. General examination, patient on the bed not in acute distress. Heat examination, atraumatic, normocephalic, PERLA, EOMI. Neck, no JVD, no signs of trauma, no tenderness on palpation. Cardiovascular, S1 S2 regular rate and rhythm. Respiratory, clear to auscultation bilaterally, no wheezes or crackles. Abdomen, soft, non-tender, non-distended, positive bowel sounds. Psych, positive SI, negative plan. Extremities, no tenderness on palpation, no edema. Neuro, grossly intact. Skin, no rashes or lesions. Physician order. Laboratory tests. Normal saline 1000 ml at 1000 ml/HR. ECG. Medications administered. Medications, sodium chloride, normal saline. Dose, 1000 ml at 1000 ml/HR. Start time, July 12, 21, 12:28. Stop time, July 12, 21, 12:40. Laboratory tests. POC glucose 116 mg/dl, 65 to 110, H. Eosinophils, 2.1%. Hematocrit, 47.6%, 42.0 to 52.0. Urine opiates screen, none detected. Urine phencyclidine screen, none detected. Urine tricyclic antidepressants, none detected. Diagnostics and interpretation. ECG interpretation by Ed MD. Normal sinus rhythm, 88 BPM, normal axis, no ST elevations or depressions on my reading. Medical decision making. Differential diagnosis considered but not limited to acute depression, suicidal ideation, homicidal ideation, drug abuse, ETOH abuse, paranoia, schizophrenia, hallucinations. Patient treated with 4 fluids, and after getting 4 fluids and is staying here in emergency room for some time, he became sober and denied any suicidal ideation afterwards. I consulted psychiatry department and they came and evaluated the patient and agree the patient is not suicidal, and they gave him outpatient referrals. I talked to the patient/family in detail about the studies done in the emergency room, diagnosis, and importance of following up with the primary care physician on the outpatient basis as soon as possible, and they agree with the plan. Impression. Primary impression, acute depression. Additional impression, ETOH abuse. Condition, stable. Disposition, discharge home. Additional instructions. Diagnosis, expected course, potential complications, and medications discussed with the patient. Patient instructed to follow up with primary care physician in 1 to 2 days and immediately return to the emergency room if symptoms worsen. Patient verbalizes understanding and willingness to comply. Attestation. Scribe attestation, documentation prepared by medical scribe listed below. I. MSEHPI/exam. Pre-Ianka, CHA prescribed December 8, 2021, 12:35. Irfan Khan December 8, 2021, 12:40. This is not considered final until signed by a physician. Authenticated by December 8, 2012. Professional Coding ICD. PDX, F32.9. SDX, F10.10. Explanation. Impression, acute depression. ETOH abuse. Index. Depression, acute, mental, F32.9. Abuse. Alcohol, non-dependent, F10.10. Professional Coding CPTs, 99,283. 93,010 99,053. CPT 99,283 Emergency Department visit for the evaluation and management of a patient, which requires these 3 key components: an expanded problem-focused history, an expanded problem-focused examination, and medical decision-making of moderate complexity. CPT 93,010, electrocardiogram, routine ECG with at least 12 leads, interpretation and report only. Arrival time, 12:10 p.m. CPT 99,053. Service or services provided in addition to basic service between 10 p.m. and 8 a.m. at a 24-hour facility. Facility coding, 93,005. A0429. CPT 93,005, ECG tracing only. CPT A0429, ambulance service, basic life support, emergency transport, BLS emergency. Mode of arrive, ambulance. Medications, sodium chloride, normal saline. Dose, 1000 ml at 1000 ml/hr. Start time, July 12, 21, 12:28. Stop time, July 12, 21, 12:40. Don't code 96,360 intravenous infusion, hydration, initial, 31 minutes to 1 hour. Reason, 40-28 equals 12 minutes. Not met minimum of 31 minutes. Demographic data. Patient name, Ram Kumar. Medical record number, MRN, 154-6234. Mode of arrival, ALS1, emergency. Date of service, October 25, 2021. Arrival time, 11:05 p.m. Chief complaint, weakness. History of present illness. 79-year-old female presenting to the emergency department with complaints of weakness, inability to walk, and shortness of breath. The patient has an elevated BNP level and was diagnosed with CHF. She was given Levoquin at Lovington. She denies chest pain but states that she has unspecified joint pains. She does not dialyze. She wears oxygen PRN at home. Her nephrologist is Drive Vijay and her cardiologist is Dr. Basha. Past medical history. Allergies. Penicillins, verified allergy, intermediate, angioedema, October 29, 19. Gabapentin, verified allergy, unknown, October 25, 20. Iodine, verified allergy, unknown, unable to obtain, October 25, 15. Travel history, travel and/or hospitalization outside the U.S. in the last 30 days. Cardiovascular history, CAD, HTN, MI, hyperlipidemia, stents, 2 stents 2001, no CABG, no DVT, no PE. Respiratory history, no COPD, no asthma. Gastrointestinal history, GI bleed, no GERD, no PUD, no cirrhosis. Endocrine history, DM type 2, no DM type 1, no hypothyroidism. Renal history, no dialysis, no kidney stones, no renal failure. Other pertinent history, chronic pain, legs, no cancer. Surgical history, no SBO. Psychiatric history, anxiety, depression, no bipolar disorder, no schizophrenia. Substance, patient denies substance abuse. Review of systems. Constitutional, general weakness. I, no blurred vision, no double vision. And, no symptoms reported. Respiratory, short of breath. Cardiovascular, no chest pain. Gastrointestinal/abdominal, no abdominal pain, no diarrhea, no nausea, no vomiting. Review of systems. Constitutional, general weakness. I, no blurred vision, no double vision. And, no symptoms reported. Respiratory, short of breath. Cardiovascular, no chest pain. Gastrointestinal/abdominal, no abdominal pain, no diarrhea, no nausea, no vomiting. GU general, no discharge, no dysuria. GU female, no symptoms reported. Musculoskeletal, inability to walk, joint pain. Skin, no symptoms reported. Neurological, no dizziness, no headache. Psychological, no symptoms reported. Endocrine, no symptoms reported. Hematologic/lymphatic, no symptoms reported. Comprehensive ROS, all other systems reviewed negative. Physical exam. Initial vital signs. Date time, October 25, 21. 11:08 p.m. Temp, 97.8. Pulse, 76. RESP, 16. B/P, 155/84. Pulse ox, 98. General examination, patient on the bed not in acute distress. Hint examination, atraumatic, normocephalic, PERLA, EOMI. Neck, no JVD, no tenderness on palpation. Chest, no signs of trauma, no tenderness on palpation. Cardiovascular, S1 S2 regular rate and rhythm. Respiratory, bilateral crackles and decreased air movement bilateral bases. Abdomen, soft, non-tender, non-distended, positive bowel sounds. Musculoskeletal, normal range of motion, no joint tenderness. Extremities, no tenderness on palpation, no edema. Neuro, grossly intact. Skin, no rashes or lesions. Diagnostics and interpretation. Lab interpretation. I personally reviewed her lab work, physician, studies done at outside facility that show BNP of over 12,000, negative EKG and negative troponin, positive UA and mildly elevated white count. Medical decision making. Differential diagnosis considered but not limited to pneumonia, pulmonary embolism, pleural effusion, acute bronchitis, acute coronary syndrome, COPD exacerbation, asthma exacerbation, acute anxiety. Patient treated with oxygen, Lasix, and she remains stable in the emergency room. I spoke with Dr. Rajan and discussed with them patient's sign and symptoms, vital signs, all the studies done, and they accepted the patient to be admitted in the hospital for further management. Impression. Primary impression, acute exacerbation of congestive heart failure. Additional impression, urinary tract infection. Condition, fair. Disposition, still a patient. Admit to, telemetry. Medical coders work. After review the entire document. Need to select codes using software. CPT, 99,285. ICD, I50. 41, and 39.0. A0427 Ambulance Service, Advanced Life Support, Emergency Transport, Level 1, ALS 1, Emergency. Sample 3 Patient Medical Record. Emergency Department Report. History of present illness. Service date September 29, 21. Arrival time, 04:27. Mode of arrival, taxi. Time seen by MD, 4:38. 46Y/OF presence to the ED with multiple lacerations to the face, arms, hip, and posterior neck. S/P being assaulted by her boyfriend. PT claims that he began assaulting her this morning, with both a knife and kicking her. PT states that she experienced a brief LOC. PT also C/OL leg pain, RI pain, R arm pain, and head pain. PT denies any sexual assault. PT denies any drug or alcohol use, but claims boyfriend was drinking alcohol. PT has had tubes tied. Past medical history. Coded allergies, no known allergies, unverified, September 29, 15. Travel history. Travel and/or hospitalization outside the US in the last 30 days. None. Other past history, tubal. Last menstrual period, August 1, 20. Smoking status, current everyday smoker. Substance, patient denies substance abuse. Review of systems. Constitutional, no symptoms reported. Eye pain. And, no symptoms reported. Respiratory, no symptoms reported. Cardiovascular, no symptoms reported. Gastrointestinal/abdominal, no symptoms reported. GU general, no symptoms reported. GU female, no symptoms reported. Musculoskeletal, L leg and hip pain, back pain. Skin, laceration, numerous lacks to arms, face, hip, and posterior neck. Neurological, LOC, headache. Psychological, no symptoms reported. Endocrine, no symptoms reported. Hematologic/lymphatic, no symptoms reported. Comprehensive ROS, all other systems reviewed negative. Physical exam. Vital signs. Date time September 29, 21, 4:08, temp 98.4, pulse 98, RESP 16. B/P142/113 pulse ox 98. General examination, patient on the bed not in acute distress, depression crying. Hint examination, normal ear, nose and throat examination, multiple abrasions noted on the face and bruise on the right side of maxilla and all neck but no lacerations, perla, EOMI. Neck, no signs of trauma, no tenderness on palpation. Chest, no signs of trauma, no tenderness on palpation. Cardiovascular, S1 S2 regular rate and rhythm. Respiratory, clear to auscultation bilaterally, no wheezes or crackles. Abdomen, soft, non-tender, non-distended, positive bowel sounds. Muscle skeletal, bruise noted for right arm which is 5 cm x 4 cm, tender function intact, neurovascular intact, positive tenderness in the patient. Left thigh examination reveals left lateral 2 cm puncture wound extending to subcutaneous tissue and possibly due to muscle, greater motion intact, tendon function intact, neurovascular intact, no active bleeding, no foreign body. Extremities, no tenderness on palpation, no edema. Neuro, alert and oriented 3, cranial nerves 2 through 12 intact, motor sensory cerebellar intact. Back, no visible deformity, no midline tenderness. Skin, as per ENT and muscle skeletal examination. Medications administered given in ed. Diphtheria/tetanus/A cell pertussis 0.5 ml 1 September 29, 21, 4:40. Morphine sulfate, morphine in J, 5 mg 1 September 29, 21, 6 o'clock to 6:40. Ondansetron HCl, Zofran in J, 4 mg 1 September 29, 21, 6 o'clock September 29, 15, 6:01 DC September 29, 15, 6:10 4 mg. Sodium chloride 1000 ml at 1,000 ml/HRQ1H1 September 29, 21, 4:40 September 29, 21, 5:39 DC September 29, 21. 6 o'clock 1000 ml/HR. Diagnostics and interpretation. Initial ECG, interp by Ed MD. Interpretation: normal sinus rhythm, 86 BPM, normal axis, no ST elevations or depressions on my reading. X-ray, interpreted by EP comments. X-ray left femur, right humerus, chest was done, films viewed by me shows nothing acute, no fractures, soft tissue swelling on the right arm. Patient/family informed that this is only preliminary read and final interpretation of all radiographs is done by radiologist, and patient/family will be notified if there is any discrepancy noted by radiologist. Patient/family verbalized understanding. CT findings. CT head without contrast, facial bones without contrast was done. Films viewed by me, read by radiologist on call, shows soft tissue swelling, otherwise no fractures or intracranial hemorrhage. Medical decision making. Differential diagnoses considered but not limited to physical assault, left thigh stab wound, right arm contusion/hematoma, strain, sprain, fractures, intracranial hemorrhage, facial fracture. Patient treated with 4 fluids, pain medication, nausea medication, Rocephin to protect his infection for stab wound. Police department involved in the evaluated and call women protective services, and patient will be released under the protection. I talked to the patient/family in detail about the studies done in the emergency room, diagnosis, and importance of following up with the primary care physician on the outpatient basis as soon as possible, and they agree with the plan. Procedures. Laceration wound repair. Lac/wound location. Location, lower extremity. Length, cm left thigh 3 cm. Depth/shape, subcutaneous. Contamination, none. Wound exploration, examined in a bloodless field. Wound inspection, distally neurovascularly intact, tendon function normal. Wound prep, betadine. Anesthesia, lidocaine with AP. Wound repaired with sutures. Suture size/type, 4-00. Number of sutures, 3. Complications, no impression. Primary impression, alleged assault. Condition, stable. Disposition, DC Other. Additional instructions, discharged under Women Protective Services. Diagnosis, expected course, potential complications, and medications discussed with the patient. Patient instructed to follow up with primary care physician in 1 to 2 days and immediately return to the emergency room if symptoms worsen. Patient verbalizes understanding and willingness to comply. Prescriptions. Ultracet every 6 hours when necessary, number 20. Phenergan 25 every 6 when necessary, number 20. Keflex 500 3 times a day, 15. Medical coders work. After review the entire document. Need to select codes using software. CPTM 99,284. 12,002 Simple repair of superficial wounds of left thigh 2.6 cm to 7.5 cm. 93,010 Electrocardiogram, routine ECG with at least 12 leads, interpretation and report only. 70,450 CT head W/O contrast. $90,471 Immunization administration, includes percutaneous, intradermal, subcutaneous, or intramuscular injections, 1 vaccine, single or combination vaccine/toxoid. 96,365 Intravenous infusion, for therapy, prophylaxis, or diagnosis, specify substance or drug, initial, up to 1 hour. 96,375 Therapeutic, prophylactic, or diagnostic injection, specify substance or drug, each additional sequential intravenous push of a new substance/drug. 96,361 intravenous infusion, hydration, each additional hour. ICD. S71.112A laceration without foreign body, left thigh, initial encounter. S40.021A contusion of right upper arm, initial encounter. S00.83XA contusion of other part of head, initial encounter. X99.1XXA assault by knife, initial encounter. ICD codes. The ICD, International Classification of Diseases, providing a method of diagnostic codes for classifying diseases, including signs, symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or illness. The ICD is a classification system developed collaboratively between the World Health Organization, WHO, and 10 international centers so that the medical terms reported by physicians, medical examiners, and coroners on death certificates can group them for statistical purposes. Examples: A41.51 sepsis due to Escherichia coli E. coli. A92.0 chikungunya virus disease. D29.21 benign neoplasm of right testis. E08.641 diabetes mellitus due to underlying condition with hypoglycemia with coma. E66.3 overweight. F12.11 cannabis abuse, in remission. G44.83 primary cough headache. G89.21 chronic pain due to trauma. R55 syncope and collapse. S03.2 dislocation of tooth. S60.511 abrasion of right hand. T23.172 burn of first degree of left wrist. V67.0 driver of heavy transport vehicle injured in collision with fixed or stationary object in non-traffic accident. W06 fall from bed. CPT codes. Current procedural terminology, CPT, is a medical code set that is used to report medical, surgical, and diagnostic procedures and services to entities such as physicians, health insurance companies and accreditation organizations. CPT codes are used in conjunction with ICD-10-CM numerical diagnostic coding during the electronic medical billing process. CPT category codes. 00100-01999. Anesthesia. 10,004 to 69,990. Surgery. 70,010 to 79,999. Radiology procedures. 0001U89398. Pathology and laboratory procedures. 90,281 to 99,607. Medicine services and procedures. 99,091 to 99,499. Evaluation and management services. 0001F9007F. Category 2 codes. 0002M0017M. Multi-analyte assay. HCPCS codes. HCPCS is a collection of standardized codes that represent medical procedures, supplies, products, and services. These codes are used to facilitate the processing of health insurance claims by Medicare and other insurers. HCPCS code category. A codes, transportation, medical and surgical supplies, miscellaneous and experimental. B codes, enteral and parenteral therapy. C codes, temporary hospital outpatient prospective payment system. D codes, Dental codes. E codes, durable medical equipment. G codes, temporary procedures and professional services. H codes, rehabilitative services. J codes, drugs administered other than oral method, chemotherapy drugs. K codes, temporary codes for durable medical equipment regional carriers. L codes, orthotic/prosthetic services. M codes, medical services. P codes, pathology and laboratory. Q codes, temporary codes. R codes, diagnostic radiology services. S codes, private payer codes. T codes, state Medicaid agency codes. V codes, vision/hearing services. Examples: A0100 non-emergency transportation, taxi. A0429 ambulance service, basic life support, emergency transport, BLS, emergency. A4217 sterile water/saline, 500 ml. A4245 alcohol wipes, per box. A4267 contraceptive supply, condom, male, each. A4931 oral thermometer, reusable, any type, each. A4928 surgical mask, per 20. C8906 magnetic resonance imaging with contrast, breast, bilateral. E0585 nebulizer with compressor and heater. E0607 home blood glucose monitor. E1221 wheelchair with fixed arm, footrests. Removal of foreign body, external eye, corneal, without slit lamp. Corneal, with slit lamp. The physician may remove a superficial foreign body or mineral deposit from the cornea with the side of the beveled edge of a needle. An incision may be required to remove an embedded foreign body. If so, the physician may cut a V-shaped incision to access the defect through a flap, or a straight incision may be made. The incision does not penetrate the cornea. Generally, a slit lamp is used with any embedded foreign body. After the removal, the physician may apply a broad-spectrum antibiotic and a moderate pressure patch over the closed lid for 24 to 48 hours. Removal of embedded foreign body, eyelid. The physician administers local anesthetic and the patient's face and eyelid are draped and prepped for surgery. The physician locates the foreign body through palpation. An incision is made through the anterior surface if the foreign body is principally on the anterior of the lid is averted if the foreign body is near the posterior surface. An attempt is made to conceal the incision line in the crease of the upper lid, or through a subciliary incision, when possible. The foreign body is removed and the wound is irrigated. The wound is repaired with layered sutures. Removal of foreign body, external eye, conjunctival superficial. Conjunctival embedded, includes concretions, subconjunctival or scleral non-perforating. The physician picks the foreign body or mineral deposit from the conjunctival with the side of the beveled edge of a needle. A small incision may be required to remove an embedded foreign body. In this case, the physician may cut a V-shaped incision to access the defect through a flap, or a straight incision may be made. The incision may penetrate the conjunctiva, but it does not penetrate the sclera. Generally, a slit lamp is used when removing any embedded foreign body. After the removal, the physician may apply a broad-spectrum antibiotic and a moderate pressure patch over the closed lid for 24 to 48 hours. Removal of foreign body, intraocular, from posterior segment, non-magnetic extraction. Diagnostic tests locate the foreign body before surgery is attempted. The physician will use intraocular forceps to retrieve the non-metallic foreign body from the area behind the lens, the posterior segment. The physician makes an incision through the conjunctiva overlying the site of the foreign body. The foreign body is retrieved with intraocular forceps. Non-metallic foreign bodies in the vitreous or retina may be removed through a pars plana approach. Either incision is repaired with a layered closure, and an injection may be required to re-establish proper fluid levels in the anterior or posterior chambers of eye. A broad-spectrum antibiotic or a pressure patch may be applied. Removal of foreign body or dacrylith, lacrimal passages. The lacrimal system serves to keep the conjunctiva and cornea moist through the production, distribution, and elimination of tears. Ducts distribute the tears to the eye and nose. The physician administers a local anesthetic along the medial canthal tendon. An incision is made midway between the bride of the nose and the medial canthal tendon. The dissection is carried down to the foreign body or lacrimal stone. It is removed, and the wound is repaired with layered sutures. Incision and removal of foreign body, subcutaneous tissues, simple. Complicated. Physician makes a simple incision in the skin overlying the foreign body. The foreign body is removed using hemostats or forceps. The skin may be sutured or allowed to heal secondarily. Report 10,121 if the procedure is more complicated, requiring dissection of underlying tissues. Example 10,120. Location, left leg. Local anesthesia, bupivacaine. Foreign body, metal hook. Incision, 15 size scalpel blade. Materials used, forceps. Dissection of underlying tissues, no. Suture, no. Removal of foreign body in muscle, or tendon sheath, simple. Deep or complicated. The physician incises the skin and dissects to the muscle or sheath. The foreign body is isolated by palpation or radiographic imagery, separately reported, and removed. The incision may be closed if clean or packed if contaminated by the object. Removal of foreign body, external eye, corneal, without slit lamp. Corneal, with slit lamp. The physician may remove a superficial foreign body or mineral deposit from the cornea with the side of the beveled edge of a needle. An incision may be required to remove an embedded foreign body. If so, the physician may cut a V-shaped incision to access the defect through a flap, or a straight incision may be made. The incision does not penetrate the cornea. Generally, a slit lamp is used with any embedded foreign body. After the removal, the physician may apply a broad-spectrum antibiotic and a moderate pressure patch over the closed lid for 24 to 48 hours. Removal of embedded foreign body, eyelid. The physician administers local anesthetic and the patient's face and eyelid are draped and prepped for surgery. The physician locates the foreign body through palpation. An incision is made through the anterior surface if the foreign body is principally on the anterior of the lid is averted if the foreign body is near the posterior surface. An attempt is made to conceal the incision line in the crease of the upper lid, or through a subciliary incision, when possible. The foreign body is removed and the wound is irrigated. The wound is repaired with layered sutures. Removal of foreign body, external eye, conjunctival superficial. Conjunctival embedded, includes concretions, subconjunctival or scleral non-perforating. The physician picks the foreign body or mineral deposit from the conjunctival with the side of the beveled edge of a needle. A small incision may be required to remove an embedded foreign body. In this case, the physician may cut a V-shaped incision to access the defect through a flap, or a straight incision may be made. The incision may penetrate the conjunctiva, but it does not penetrate the sclera. Generally, a slit lamp is used when removing any embedded foreign body. After the removal, the physician may apply a broad-spectrum antibiotic and a moderate pressure patch over the closed lid for 24 to 48 hours. Removal of foreign body or dacrylith, lacrimal passages. The lacrimal system serves to keep the conjunctiva and cornea moist through the production, distribution, and elimination of tears. Ducts distribute the tears to the eye and nose. The physician administers a local anesthetic along the medial canthal tendon. An incision is made midway between the bride of the nose and the medial canthal tendon. The dissection is carried down to the foreign body or lacrimal stone. It is removed, and the wound is repaired with layered sutures. Removal foreign body from external auditory canal, without general anesthesia. With general anesthesia. Under direct visualization, the physician or technician removes a foreign body from the external auditory canal using delicate forceps, a cerumen spoon, or suction. In the case of a live insect, oil is dropped into the ear to immobilize it before it is removed. If a child or an adult cannot tolerate the procedure while awake, it is performed under general anesthesia. Indiana 69205. Code 69205 is also reported in cases where the foreign body is so large, an incision is made in the external meatus to enlarge the opening before the foreign body can be extracted. Removal foreign body, intranasal, office-type procedure. Requiring general anesthesia. The physician removes a foreign body from the inside of the nasal cavity, in the office for 30,300 or under general anesthesia for 30,310. Foreign bodies are defined as objects not normally found in the body. An object may be embedded in normal tissue as a result of some type of trauma. Topical vasoconstrictive agents and local anesthesia are applied to the nasal mucosa. A small incision may be necessary to access the foreign body. Blunt dissection and retrieval of the object is performed with hemostats or forceps. Sutures may close the mucosa in a single layer if the size of the dissection requires. Removal foreign body, intranasal, bilateral rhinotomy. The physician removes a foreign body from deep within the nasal cavity, accessing the area with a lateral rhinotomy surgical approach. This foreign body is located in an area of difficult access and requires complex surgery to remove it. A full-thickness skin incision is made from the nostril extending along the nasal alar rim and continuing superiorly. The incision can extend to the medial aspect of the eyebrow if necessary. The lateral aspect of the nose is retracted, exposing the bony structures beneath the soft tissue. Blunt dissection and retrieval of the object is performed with hemostats or forceps. The surgical wound is closed in layers. Exploration with removal of deep foreign body, forearm, or wrist. The physician removes a deeply implanted foreign body from the forearm or wrist. The physician incises the site and dissects down to reach the area where the foreign object is embedded. Exploration of the site is done. Separately reportable X-rays may be taken to locate the object. All parts of the object are removed. The wound is sutured in layers. Removal of foreign body, upper arm, or elbow area, subcutaneous. Deep, subfascial or intramuscular. The physician removes a foreign body of the upper arm or elbow area. If the foreign body is a result of trauma, an open wound may already exist. The physician may make a separate incision or access the foreign body through the open wound. More extensive dissection in a larger incision may be necessary for a deep foreign body. Once the foreign body is visualized, it is removed. The physician may also debride any surrounding damaged soft tissue. The wound is irrigated. Drains may be placed in the wound and the incision repaired in layers with sutures, staples, and slash or stri strips. A splint may be applied to limit elbow motion. Removal foreign body, foot, subcutaneous. Deep. Complicated. Subcutaneous refers to something under the skin. An incision is made through the skin and it is reflected to expose the foreign body. It is removed and the wound is irrigated and the wound is closed. A dressing is applied and aftercare may include antibiotic injection into the wound and orally. Weight bearing is allowed as the wound heals. Removal of foreign body, pelvis, or hip, subcutaneous tissue. Deep, subfascial or intramuscular. The physician makes an incision overlying the site of the foreign body in the pelvis or hip. The foreign body is removed from the subcutaneous tissue. Indiana 27086. Deeper dissection is required. Indiana 27087, and more attention may be given to possibly damaged vessels and slash or nerves. The physician irrigates the wound. The incision is repaired with sutures, staples, and slash or stri strips. Removal foreign body, deep, thigh region or knee area. The physician removes a foreign body, i.e., nail, piece of wood, in the thigh or knee. For a foreign body in the thigh, an incision is made overlying the object. Tissue is dissected around the object. The physician may need to suture damaged muscle or other soft tissues. The wound is irrigated with antibiotic solution. The incision will typically be closed, unless an infection is present, in which case it will be left open temporarily to drain. Removal of foreign body, shoulder, subcutaneous. The physician removes a foreign body of the shoulder. The physician makes a small incision over the foreign body and reflects the skin to expose it. The foreign body is removed, the wound is irrigated, and the skin is closed with sutures or stri strips. Removal of foreign body, shoulder, deep, subfascial or intramuscular. The physician removes a foreign body from deep within the shoulder, such as an artificial shoulder joint. A long incision is made overlying the shoulder. The physician dissects through each layer of tissue down to the bones in the shoulder. The shoulder joint is exposed. The physician may debride any inflamed synovial or other scar tissues. The foreign body is removed from within the joint and from inside the humerus bone. The physician irrigates the joint with antibiotic solution. The wound is closed in layers unless there is infection present. If infection is present, the wound is left open to drain. AAA abdominal aortic aneurysm. OPMC antibiotic-associated pseudomembranous colitis. AAT activity is tolerated. AAL anterior axillary line. AAOX3 awake, alert, and oriented, ×3. ABCD airway, breathing, circulation, disability. Asymmetry borders color diameter, rating for cancer. AB acute bacterial endocarditis. ABG arterial blood gas. ABI acquired brain injury. Ankle brachial pressure index. ABMT autologous bone marrow transplantation. ABN abnormal. ABPA allergic bronchopulmonary aspergillosis. ABX antibiotics. ACB aortocoronary bypass. AC and BC air conduction and bone conduction, Weber test. ACC accommodation, I. Acute coronary care unit. ACD anemia of chronic disease. ACDF anterior cervical discectomy and fusion. ACEI angiotensin converting enzyme inhibitor. Acetylcholine esterase. ACL anterior cruciate ligament. ACLS advanced cardiac life support. ACS acute coronary syndrome. ACTH adrenocorticotropic hormone. ACU ambulatory care unit. AD Alzheimer's disease. Acute distress. Right ear. ADA adenosine deaminase. ADC AIDS dementia complex. AD attention deficit disorder. ADH antidiuretic hormone. ADHD attention deficit hyperactivity disorder. ADHR autosomal dominant hypophosphatemic rickets. ADLS activities of daily living. ADP adenosine diphosphate. ADR adverse drug reaction. AED automated external defibrillator. Antiepileptic drug. AEM ambulatory electrocardiogram monitoring. AF atrial fibrillation. Atrial flutter. Amniotic fluid. AFB acid fast bacilli. AFib atrial fibrillation. AFO ankle-foot orthosis. AFP alpha-fetoprotein. AG antigen. AGA, antigliadin antibodies. Appropriate gestational age. AGC atypical glandular cells. Ages criteria, age, grade, extent, size, for tumors. AGN acute glomerulonephritis. AHF antihemophilic factor. AHG antihemophilic globulin. Aryl hydrocarbon hydroxylase. AHR airway hyperreactivity. AI artificial insemination. Aortic insufficiency. AICD automated implantable cardioverter defibrillator. AID artificial insemination by donor. AIDS acquired immune deficiency syndrome. AIH artificial insemination by husband. AIHD artificial insemination by pooled husband and donor semen. AIPD acute infectious and parasitical diseases. Autoimmune progesterone dermatitis. Acute inflammatory demyelinating polyneuropathy. AIRB angiotensin II receptor antagonist. An acute interstitial nephritis. ACE adenocarcinoma in situ. aka above knee amputation. Also known as alla-aminolavulinic acid. ALC alcohol. ALK anti-lymphocytic globulin. ALI acute lung injury. ALK phos alkaline phosphatase. AL, acute lymphoblastic leukemia. Allergies. ALP alkaline phosphatase. ALPS autoimmune lymphoproliferative syndrome. ALS, amyotrophic lateral sclerosis. Advanced life support. Alt-alanine transaminase. AMA, advanced maternal age, 35 years or greater. Against medical advice. Antimitochondrial antibody. American Medical Association. AMB ambulate. AMC arthrogryposis multiplex congenita. AMI acute myocardial infarction. AML acute myeloid leukemia. Ampadenosine monophosphate. AMP ampule. Ampere. AMS, altered mental status. Acute mountain sickness. Atypical measles syndrome. AMT amount. ANA antinuclear antibody. ANCA antineutrophil cytoplasmic antibody. ANF atrial natriuretic factor. ANP atrial natriuretic peptide. ANS autonomic nervous system. ANT anterior. ANTR asymmetrical tonic neck reflex. ANUG acute necrotizing ulcerative gingivitis. ANO aware and oriented. ANDOX 3 alert and oriented, times 3. ANDOX 4 alert and oriented, times 4, to person, place, time, and circumstances. AODM adult onset diabetes mellitus, DM type 2. AOM acute otitis media. AP, anteroposterior. Alkaline phosphatase. Angina pectoris. ANP auscultation and percussion. APAP automatic positive airway pressure. APC, atrial premature contraction. Antigen presenting cell. Activated protein C. APD, adult polycystic disease. Automated peritoneal dialysis. APKD adult polycystic kidney disease. APST autoimmune polyendocrinopathy candidiasis ectodermal dystrophy. APGAR appearance, pulse, grimace, activity, respiration, used to assess newborns. APH antepartum hemorrhage. APL's antiphospholipid syndrome. APMP acute posterior multifocal placoid pigment epitheliopathy. APR abdominoperineal resection. APS, autoimmune polyendocrine/polyglandular syndrome. APSIC anisoylated plasminogen streptokinase activator complex. APTT activated partial thromboplastin time. AR aortic regurgitation. ARB angiotensin II receptor antagonist. ARC AIDS related complex. ARDS acute respiratory distress syndrome. Adult respiratory distress syndrome. ARF acute renal failure. ARC arginine. ARM artificial rupture of membranes. AROM, active range of motion. Artificial rupture of membranes. ART, Antiretroviral therapy. Assuming room temperature. ARVC arrhythmogenic right ventricular cardiomyopathy. ARVD arrhythmogenic right ventricular dysplasia. As aortic stenosis. Atherosclerosis. ASA acetylsalicylic acid, aspirin. ASAP as soon as possible. ASC ambulatory surgery center. ASCAD arteriosclerotic coronary artery disease. ASCUS atypical squamous cells of undetermined significance. ASCUS atypical squamous glandular cells of undetermined significance. ASD atrial septal defect. ASCVD arteriosclerotic vascular disease. ASHD arteriosclerotic heart disease. ASIS anterior superior iliac spine. ASOT anti-streptolysin titer. AS assessment. AST aspartate transaminase. ASX asymptomatic. AT antithrombin. Angiotensin. ATA anti-transglutaminase antibodies. ATB antibiotic. ATCC American Type Culture Collection. ATG antithymic globulin. AT3 antithrombin 3. ADN acute tubular necrosis. ATNR asymmetrical tonic neck reflex. AXR abdominal X-ray. ADP, acute thrombocytopenic purpura. Adenosine triphosphate. Anti-tachycardia pacing. ADP atopical. Atrial trans-retinoic acid. ATS anti-tetanus serum. AV, arteriovenous. Atrioventricular. AVM arteriovenous malformation. AVN avascular necrosis. AVR aortic valve replacement. ANW alive and well. AX axillary. AZT azidothiamidine. BX biopsy. BAC blood alcohol content. BAL blood alcohol level. Bronchoalveolar lavage. BAO basic acid output. BAT brown adipose tissue. BBB blood-brain barrier. Bundle branch block. BC, bone conduction. Blood culture. BCC basal cell carcinoma. Blind carbon copy. BCG bacil calmette-guerin. BCP birth control pill. BCX blood culture. BBMF bone break, ME-fix, orthopedic consent form. BD, bipolar disorder. BDD body dysmorphic disorder. BDI Beck depression inventory. B, barium enema. Base excess. BFP bundle forming pilus. BGAT blood glucose awareness training. BGL blood glucose level. BIB brought in by. BIBA brought in by ambulance. BiPAP bilevel positive airway pressure. BiVAD bilateral ventricular assist device. BK bradykinin. BKA below the knee amputation. BL cold blood culture. BLD blood. BLS basic life support. BM bowel movement. BMC bone mineral content. BMD bone mineral density. BMI body mass index. BMP blood metabolic profile. BMR basal metabolic rate. BMT bone marrow transplantation. BNO bowel not open. BNP brain natriuretic peptide. BO bowel open. B/O because of. BOA born out of a sepsis. BOI born on island, i.e., a local patient. BOM bilateral otitis media. BOOP bronchiolitis obliterans organizing pneumonia. BP, blood pressure. Bipolar disorder. BPAD bipolar affective disorder. BPD biparietal diameter. Bronchopulmonary dysplasia. Borderline personality disorder. BPH benign prostatic hyperplasia. BPM beats per minute. BPPV benign paroxysmal positional vertigo. BR bed rest. Bathroom. BRA bilateral renal agenesis. Brady diet, bananas, rice, applesauce, toast, yogurt. BRBPR bright red blood per rectum. BRCA1 breast cancer 1, gene. BS, breath sound. Bowel sounds. Blood sugar. BSA body surface area. BSC bedside commode. BSE bovine spongiform encephalopathy. Breast self-examination. BSL blood sugar level. BT bleeding time. BTL bilateral tubal ligation. BTP breakthrough pain. BUN blood urea nitrogen. BV bacterial vaginosis. BVP biventricular pacing. BW blood work. BX biopsy. BZDs benzodiazepines. CABG coronary artery bypass graft. CABP coronary artery bypass procedure. CAD coronary artery disease. Cadacil cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. CAG coronary artery graft. Coronary angiography. CAGS coronary artery graft surgery. CAMP cyclic adenosine monophosphate. CAH chronic active hepatitis. Congenital adrenal hyperplasia. CAPD continuous ambulatory peritoneal dialysis. CAPS capsule. CAD computed axial tomography. Cath catheter. CBC complete blood count. CBC/diff complete blood count/differential. CBD common bile duct. CBS chronic brain syndrome. cc cubic centimeter. cc chief complaint. Cardiac catheter. Carbon copy. CCCU critical coronary care unit. CCE clubbing, cyanosis, and edema. CCF congestive cardiac failure. CCK cholecystokinin. CCKPZ cholecystokinin pancreozymin. CCR cardiocerebral resuscitation. CCU coronary care unit. Critical care unit. CD Crohn's disease. CDH congenital dislocated hip. CDP cytosine diphosphate. CEA, carcinoembryonic antigen. Carotid endarterectomy. Cost-effectiveness analysis. CF cystic fibrosis. CFA colonization factor antigen. CFIDS chronic fatigue immune dysfunction syndrome. CFS chronic fatigue syndrome. CFTR cystic fibrosis transmembrane conductance regulator. CGMP cyclic guanosine monophosphate. CGN chronic glomerulonephritis. CH congenital hypothyroidism. CHD chronic heart disease. CHE cholinesterase. CHD coronary heart disease. CHE cholinesterase. CHF congestive heart failure. CHO carbohydrate. cholesterol. CHT congenital hypothyroidism. CI confidence interval. Cardiac index. CICU cardiac intensive care unit. CIDP chronic inflammatory demyelinating polyneuropathy. CIN cervical intraepithelial neoplasia. CIRC circumcision. Circulation. Cis carcinoma in situ. CJD Creutzfeldt-Jakob disease. CK creatine kinase. Creatinine phosphokinase. CKD chronic kidney disease. CKMB isoenzyme of creatine kinase. CLL chronic lymphocytic leukemia. CMD cystic medial degeneration. CME continuing medical education. CML chronic myeloid leukemia. CMML chronic myelomonocytic leukemia. CMP complete metabolic panel. CMS chronic mountain sickness. CMT cervical motion tenderness. CMV cytomegalovirus. CN cranial nerves. CNS central nervous system. Crigler-Najjar syndrome. C/O complains of CO cardiac output. Carbon monoxide. Code chronic obstructive airways disease. COCP combined oral contraceptive pill. Cold chronic obstructive lung disease. CONJ conjunctiva. COPD chronic obstructive pulmonary disease. CO2 carbon dioxide. CP, cerebral palsy. Chest pain. CPAP continuous positive airway pressure. CPC clinical pathological conference. CPE Clostridium perfringens enterotoxin. CPK creatine phosphokinase. CPKMB creatine phosphokinase and myoglobin. CPP cerebral perfusion pressure. CPR cardiopulmonary resuscitation. CPT current procedural terminology. CR complete remission. CR creatinine. CRCL creatinine clearance. Crete creatinine. CRF, chronic renal failure. Corticotropin releasing factor. CRGN crescentic glomerulonephritis. CRH corticotropin releasing hormone. CRI chronic renal insufficiency. CRIT hematocrit. CRP C-reactive protein. CRT cardiac resynchronization therapy. CS cesarean section. CNS culture and sensitivity, antibiogram. CSA cyclosporin A. CSF cerebrospinal fluid. Colony stimulating factor. CT computed tomography. CTA, computed tomography angiography. Clear to auscultation. CTS computed tomography scan. CTU cancer treatment unit. CTX ceftriaxone. Contractions. CV cardiovascular. CVA cerebrovascular accident. Costovertebral angle. CVAT costovertebral angle tenderness. CVC central venous catheter. Chronic venous congestion. CVD cardiovascular disease. CVI cerebrovascular incident. CVP central venous pressure. CVS chorionic villus sampling. Cardiovascular system. CVID common variable immunodeficiency. CWP coal workers pneumoconiosis. CX microbiological culture. CXR chest X-ray. DX or DS diagnosis. D5 5% dextrose. D5W 5% dextrose in water. DW dextrose in water. D-dopamine. DAEC diffusely adherent Escherichia coli. Daily disability adjusted life year. DBP diastolic blood pressure. DBS deep brain stimulation. DNC dilatation and curettage. D/C discontinue. Discharge. DCBE double contrast barium enema. DCIS ductal carcinoma in situ. DCM dilated cardiomyopathy. DD differential diagnosis. DDD daily defined doses. DDX differential diagnosis. DNE dilatation and evacuation. D-diethylstilbestrol. DEXA dual energy X-ray absorptiometry. DH developmental history. DHE dihydroergotamine. DHEAS dehydroepiandrosterone sulfate. DHF decompensated heart failure. D diabetes insipidus. DIB dead in bed. DIC disseminated intravascular coagulation. DILI drug-induced liver injury. DIP distal interphalangeal joint. DPT or DIPRTE diphtheria pertussis tetanus. DIT diphtheria tetanus. Dislocation. D/C or dish discharge. DIU death in utero, stillbirth. DJD degenerative joint disease. DKA diabetic ketoacidosis. DL deciliter. DLE disseminated lupus erythematosus. DM diabetes mellitus. DMARD disease modifying antirheumatic drug. DMD Duchenne muscular dystrophy. DNA deoxyribonucleic acid. DNI do not intubate. DNR do not resuscitate. DNAR do not attempt resuscitation. DOA dead on arrival. Drugs of abuse. DOB date of birth. DO dyspnea on exertion. DOS docusate sodium. DP dorsalis pedis. DPH diphenylhydantoin. DPL diagnostic peritoneal lavage. DRT dead right there. DS or DZ disease. DS Down syndrome. DSA digital subtraction angiography. DSD dry sterile dressing. DSG dressing. DT diphtheria tetanus. Delirium tremens. DTA descending thoracic aorta. DTAP diphtheria tetanus acellular pertussis. DTP diphtheria tetanus pertussis. DTR deep tendon reflex. DT's delirium tremens. Duodenal ulcer. DUB dysfunctional uterine bleeding. DVT deep vein thrombosis. EAC external acoustic meatus. EACA epsilon aminocaproic acid. EBL estimated blood loss. EBM evidence-based medicine. Expressed breast milk. EBT electron beam tomography. EBV Epstein-Barr virus. EC enteric coating. ECF extracellular fluid. ECG electrocardiogram. ECM extracellular matrix. Echo-enteric cytopathic human orphan virus. ECLS extracorporeal life support. ECMO extracorporeal membrane oxygenation. ECP emergency care practitioner. ECT electroconvulsive therapy. ED emergency department. Erectile dysfunction. Ectodermal dysplasia. EDC estimated date of confinement. ED estimated date of delivery. Expected date of delivery. Estimated date of discharge. ED epidural hematoma. EDM esophageal Doppler monitor. EDDA ethylene diamine tetrasic acid. EDVN diastolic volume. EEE Eastern equine encephalitis. EEG electroencephalogram. EENT ears, eyes, nose, throat. EEX electrodiagnosis. F ejection fraction. EFM electronic fetal monitoring. EGBUS external genitalia, Bartholin's glands, urethra and Skene's glands. EGD esophagogastroduodenoscopy. EGF epidermal growth factor. EHEC enterohemorrhagic Escherichia coli. EIEC enteroinvasive Escherichia coli. EJ elbow jerk, triceps reflex. EKG electrocardiogram. ELSC selective lower segment cesarean section. ELISA enzyme-linked immunosorbent assay. MBX endometrial biopsy. EMC encephalomyocarditis. EMD early morning discovery. EMF endomyocardial fibrosis. EMG electromyography. ELSC emergency lower segment cesarean section. EMU early morning urine sample, pregnancy test. EMAL emulsion. EOM extraocular muscles. EOMI extraocular movements intact. EPEC enteropathogenic Escherichia coli. F edema proteinuria hypertension. EPO erythropoietin. EPS electrophysiology. ER emergency room. ERCP endoscopic retrograde cholangiopancreatography. ESL extracorporeal shockwave lithotripsy. ESBL extended spectrum beta-lactamase. ESR erythrocyte sedimentation rate. ESRD end-stage renal disease. ESVN systolic volume. ESWL extracorporeal shockwave lithotripsy. ET endothelin. Endotracheal. ETEC enterotoxigenic Escherichia coli. Etiology. ETOH ethanol, ethyl alcohol. ETS endoscopic thoracic sympathectomy. ETT endotracheal tube. EUA examination under anesthesia. EUP extrauterine pregnancy. EUS endoscopic ultrasonography. EVAR endovascular aneurysm repair. EVF erythrocyte volume fraction. Examination. EXP lap exploratory laparotomy. EXT extremities. FX fracture. FAM familial atypical multiple mole melanoma. FAP familial adenomatous polyposis. Fast focused assessment with sonography for trauma. FB foreign body. FBC full blood count. FBE full blood exam. FBG fasting blood glucose. FBS fasting blood sugar. F/C fevers and/or chills. FDC follicular dendritic cells. FDIU fetal demise in utero. FDP fibrin degradation product. FEV1 forced expiratory volume in 1 second. FE iron. Female. Femoral. FEP free erythrocyte protoporphyrin. FF free fluids, non-thickened fluids. FFA-free fatty acids. FFP fresh frozen plasma. FHR fetal heart rate. FHS fetal heart sound. FHT fetal heart tones. FHX family history. FIBD found in bed dead. Fish fluorescence in situ hybridization. FLK funny looking kid. Fluid ounce. FMF fetal movements felt. FMP first menstrual period. fMRI functional magnetic resonance imaging. FN finger to nose test. FNA fine needle aspiration. FNAB fine needle aspiration biopsy. FNAC fine needle aspiration cytology. FNC full nursing care. FNH focal nodular hyperplasia. FOBT fecal occult blood test. FOF found on floor, patient fell out of bed. FOS full of stool. FPG fasting plasma glucose. From full range of motion. FSBS fingerstick blood sugar. FSE fetal scalp electrode. FSGS focal and segmental glomerulosclerosis. FSH follicle stimulating hormone. FTAABS fluorescent treponemal antibody absorption. FTT failure to thrive. F/U follow-up. FUO fever of unknown origin. FVC forced vital capacity. FWB full weight bearing. FWD full ward diet. Forward. FX fracture. G gravidity. Guanosine. G6PD glucose 6-phosphate dehydrogenase. GA general anesthesia. GABA gamma aminobutyric acid. GB gallbladder. GBS Guillain-Barré syndrome. GBM glioblastoma multiforme. Glomerular basement membrane. GC general condition. Gonococcus. GCA giant cell arteritis. GCS Glasgow coma scale. GCSF granulocyte, colony stimulating factor. GDA gastroduodenal artery. GDLH glutamate dehydrogenase. GDP guanosine diphosphate. GERD gastroesophageal reflux disease. GFR glomerular filtration rate. GGT gamma glutamyl transferase. GGTP gamma glutamyl transpeptidase. GHRF growth hormone releasing factor. GI gastrointestinal. Gift gamete intrafallopian transfer. GIST gastrointestinal stromal tumor. GIT gastrointestinal tract. GITS gastrointestinal therapeutic system. GMC general medical condition. GMP guanosine monophosphate. GN glomerulonephritis. GnRH gonadotropin releasing hormone. GOAT Galveston orientation and amnesia test. GOD glucose oxidase. GOT glutamic oxalacitic transaminase. GP general practitioner. GPT glutamic pyruvic transaminase. GRAVI indicating woman during first pregnancy. GSW gunshot wound. GTN glyceryl trinitrate. GDT glucose tolerance test. GU genitourinary. Gastric ulcer. GVHD graft versus host disease. GXT graded exercise test. GYN gynecology. H-hour. H-histamine. Hemagglutinin. HX history. Hypertonia arterialis. Headache. H/A headache. HB% hemoglobin concentration. HbA hemoglobin A. HbA1c glycosylated hemoglobin. HBD has been drinking. HbF fetal hemoglobin. HbP high blood pressure. HC hemorrhagic colitis. HCC hepatocellular carcinoma. HCG human chorionic gonadotropin. HB% hemoglobin concentration. HbA hemoglobin A. HbA1c glycosylated hemoglobin. HBD has been drinking. HbF fetal hemoglobin. HbP high blood pressure. HC hemorrhagic colitis. HCC hepatocellular carcinoma. HCG human chorionic gonadotropin. HBsAg hepatitis B surface antigen. Ha hepatitis associated antigen. HAV hepatitis A virus. HBV hepatitis B virus. HCV hepatitis C virus. HDV hepatitis D virus. HEV hepatitis E virus. HGV hepatitis G virus. HCl hairy cell leukemia. HCM hypertrophic cardiomyopathy. HCT hematocrit. HCT hematopoietic cell transplantation. HCRP hospital cornea retrieval program. HCDZ hydrochlorothiazide. HD Hodgkin's disease. HDLC high density lipoprotein cholesterol. HDU high dependency unit. HNE hematoxylin and eosin. Hint head, eyes, ears, nose, throat. Help hypertension elevated liver enzymes low platelets. Hemohydroxyethyl methacrylate. Hema test. Fecal occult blood. Hes hydroxyethyl starch. HETE hydroxyicosatitranoic acid. HFM hand, foot and mouth disease. HFRS hemorrhagic fever with renal syndrome. HCl high grade squamous intraepithelial lesion. HH hiatus hernia. HNH hemoglobin and hematocrit. HHT hereditary hemorrhagic telangiectasia. HHV human herpes virus. High homicidal ideation. HIB Haemophilus influenza B. HIDS hyperagude syndrome. HIT heparin-induced thrombocytopenia. HIV human immunodeficiency virus. HL hepatic lipase. Hodgkin's lymphoma. Hearing level. HLA human leukocyte antigen. HLHS hypoplastic left heart syndrome. HNM hematemesis and melena. HMD hyaline membrane disease. HMS hyperreactive malarial splenomegaly. HMSN hereditary motor sensory neuropathy. HN hemagglutinin neuraminidase. HND hemolytic disease of the newborn. HNPCC hereditary non-polyposis colorectal cancer. HX or H/O history of Hob head of bed. HOCM hypertrophic obstructive cardiomyopathy. HONC hyperosmolar noncatotic coma. HNP history and physical examination. HPA hypothalamic pituitary adrenal axis. HPAD hydroxyicosatitranoic acid. HPF high power field, microscopy. HPI history of the present illness. HPOA hypertrophic pulmonary osteoarthropathy. HPL human placental lactogen. HPS hantavirus pulmonary syndrome. HPV human papillomavirus. HR heart rate. HRCT high resolution computed tomography, HRT hormone replacement therapy, HS hours of sleep, HS Hiltischen test, HSC human chorionic somatomamotropin, HSG hysterosalpingogram, HSIL high-grade squamous intraepithelial lesion, HSV Hainoxian line purpura, HSV herpes simplex virus, HT hypertension, HT height, HTLV human T lymphotropic virus. HTN hypertension, HTPA hypothalamic pituitary adrenal axis, HTVD hypertensive vascular disease, Hus hemolytic uremic syndrome, HVLT high velocity lead therapy, IA intra-arterial, IABP intra-aortic balloon pump, IAI intra-amniotic infection. IC ileocecal, immunocompromised, informed consent, intensive care, interstitial cystitis, immune complex, IBC inflammatory breast cancer, IBD inflammatory bowel disease, IBS irritable bowel syndrome, ICD implantable cardioverter defibrillator, ICDS integrated child development services program, ICD-10 International Classification of Diseases 10th revision. ICF intracellular fluid, ICG impedance cardiography, ICH intracerebral hemorrhage, ICP intracranial pressure, ICS intercostal space, ICU intensive care unit, ICCU intensive cardiac care unit, ID infectious disease, identifying data. IND incision and drainage, IDA iron deficiency anemia, IDC idiopathic dilated cardiomyopathy, indwelling catheter, infiltrating ductal carcinoma, IDDM insulin-dependent diabetes mellitus, IDL intermediate density lipoprotein, IDP infectious disease precautions/process, if immunofluorescence. IFG impaired fasting glycemia, IG immunoglobulin, IGT impaired glucose tolerance, IHC immunohistochemistry, IHD ischemic heart disease, IM intramuscular, IMI intramuscular injection, IMA inferior mesenteric artery. IMB intermenstrual bleed, IMN infectious mononucleosis, IMT intima media thickness, IMV intermittent mandatory ventilation, INC incomplete, INH isoniazid, INJ injection, INR international normalized ratio. INT internal, IO intraosseous infusion, INO inputs and outputs, intake and outputs, IOL induction of labor, intraocular lens, IOP intraocular pressure, IP interphalangeal joint, IPF idiopathic pulmonary fibrosis, IPS intraperitoneal sounds. IPPV intermittent positive pressure ventilation, IQ intelligence quotient, IR insulin resistance, IRDS infant respiratory distress syndrome, ISA intrinsic sympathomimetic activity, ISDN isosorbide dinitrate, ISH isolated systolic hypertension, ISMN isosorbide mononitrate, IT intrathecal. IDP idiopathic thrombocytopenic purpura. Immune-mediated thrombocytopenic purpura. ITU intensive treatment unit. IUCD intrauterine contraceptive device. IU international units. IUD intrauterine death. Intrauterine device. IUFD intrauterine fetal demise. IUGR intrauterine growth retardation. IUI intrauterine insemination. IUP intrauterine pregnancy. IUS intrauterine system. 4 intravenous. IVC inferior vena cava. 4 DSA intravenous digital subtraction angiography. IVDU intravenous drug user. IVF in vitro fertilization. Intravenous fluids. IVP intravenous pyelogram. IVPB intravenous piggyback. IVU intravenous urogram. IVUS intravascular ultrasound. JCV John Cunningham virus. JEV Japanese encephalitis virus. Juvenile idiopathic arthritis. JMS junior medical student. JODM juvenile onset diabetes mellitus. JRA juvenile rheumatoid arthritis. JVD jugular vein distension. JVP jugular venous pressure. K potassium. Ca ketoacidosis. K cal kilocalorie. KCCT kalencephalon clotting time. Kg kilogram. KIV keep in view. KLS kidney, liver, spleen. KS Kaposi's sarcoma. Cartagener syndrome. KSHV Kaposi's sarcoma associated herpes virus. KUB kidneys, ureters, and bladder, X-ray. KVO keep vein open, with slow infusion. LND labor and delivery. LA lymphadenopathy. Left atrium. Lab laboratory. Lab left anterior bundle branch block. LAD leukocyte adhesion deficiency. Lymphadenopathy. Left axis deviation, ECG. LA left atrial enlargement. LAHB left anterior hemiblock. LAM laminectomy. LAP leukocyte alkaline phosphatase. LAP laparotomy. LAR low anterior resection. Loss lymphadenopathy syndrome. LAT lateral. LB, LB pound, mass. LBBB left bundle branch block. LBO large bowel obstruction. LBP low back pain. LBW low birth weight. LCA left coronary artery. LCIS lobular carcinoma in situ. LCM lymphocytic meningitis. LCMV lymphocytic choriomeningitis virus. LCV leukocytoclastic vasculitis. LCX left circumflex artery. LND labor and delivery. LDH lactate dehydrogenase. LDLC low-density lipoprotein cholesterol. LEC lupus erythematosus cell. LEEP loop electrical excision procedure. LE lower esophageal sphincter. Lupus erythematosus systemicus. LE lupus erythematosus. Lower extremity. LEU leukocytes. LFT liver function test. LGA large for gestational age. LGL Loneganong-Levine syndrome. LGM lymphogranulomatosis maligna. LXIL low-grade squamous intraepithelial lesion. LGV lymphogranuloma venereum. LH luteinizing hormone. LIG ligament. LIH left inguinal hernia. LLE left lower extremity. Let's large loop excision of the transformation zone. LLL left lower lobe. LLQ left lower quadrant. LM left main. LMA left mento anterior, fetal position. LOP left occipito posterior, fetal position. LOA left occipito anterior, fetal position. Lysis of adhesions. LMCA left main coronary artery. LMD local medical doctor. LMP last menstrual period. LN lymph node. LOC loss of consciousness. Level of consciousness. LOF leakage of fluid. LORTA loss of resistance to air. LOS length of stay. LOT lotion. LP lipoprotein. LP lumbar puncture. LPH left posterior hemi-block, heart block. LPL lipoprotein lipase. LSB left sternal border. LSIL low-grade squamous intraepithelial lesion. LR lactated Ringer's solution. LRTI lower respiratory tract infection. LT heat label enterotoxin. LTAC long-term acute care. LTCS low transverse C-section. LUL left upper lobe. LUQ left upper quadrant. LV left ventricle. LVAD left ventricular assist device. LVAD left ventricular and diastolic pressure. LVEF left ventricular ejection fraction. LVF left ventricular failure. LVH left ventricular hypertrophy. LVOT left ventricular outflow tract. LWBS left without being seen. LX of CH laxative of choice. Li lymphocytes. Lights electrolytes. May moves all extremities. MAHA microangiopathic hemolytic anemia. MAL mid-axillary line. MALT mucosa associated lymphoid tissue. MAOI monoamine oxidase inhibitor. M5 macrophage. MAP mean arterial pressure. MC metacarpal bone. Marsamethicillin and aminoglycoside resistant Staphylococcus aureus. Moss Morgani Adams-Stokes syndrome. MAT multifocal atrial tachycardia. Microscopic agglutination test. MCD minimal change disease. MCP metacarpophalangeal joint. MDD major depressive disorder. MDE major depressive episode. MCHC mean cell hemoglobin concentration. MCH mean cell hemoglobin. Mean corpuscular hemoglobin. MCNS microscopy, culture, and sensitivity. MCV mean cell volume. MDS myelodysplastic syndrome. M/E microscopic examination. Men multiple endocrine neoplasia. MESH medical subject headings. MET metabolic equivalent. MET metastasis. Mg magnesium. MGN membranous glomerulonephritis. MgSO4 magnesium sulfate. MGUS monoclonal gammopathy of undetermined significance. MI myocardial infarction. MIC minimum inhibitory concentration. MICA mental illness and chemical abuse. Mentally ill chemical abuser. MICU mobile intensive care unit. MLC mixed lymphocyte culture. MLE midline episiotomy. MM myeloid metaplasia. MNM morbidity and mortality. MMPI Minnesota Multiphasic Personality Inventory. MN Membranous Nephropathy. MOD Moderate. Modified. MODI Maturity Onset Diabetes of the Young. MO Monocytes. MOM Milk of Magnesia. MPD Myeloproliferative Disease. MPGN Membranoproliferative Glomerulonephritis. MPV Mean Platelet Volume. Mr. Mitral Regurgitation. Modified Release. Medical Representative. Mental Retardation. MRA Magnetic Resonance Angiography. MRCP Magnetic Resonance Cholangiopancreatography. MRG Murmurs, rubs, and gallops. MRI Magnetic Resonance Imaging. MRSA Methicillin-resistant Staphylococcus aureus. MS Mitral stenosis. Multiple sclerosis. MSE Mental Status Examination. MSH Melanocyte Stimulating Hormone. MSK Medullary Sponge Kidney. MSO4 Morphine or morphine sulfate. MSU Midstream Urine Sample. MSUD Maple Syrup Urine Disease. MT Metatarsal Bone. MTBI Mild Traumatic Brain Injury. MTP Metatarsalphalangeal Joint. MTX Methotrexate. MVA Motor Vehicle Accident. MVC Motor Vehicle Crash. MVP Mitral Valve Prolapse. MVPS Mitral Valve Prolapse Syndrome. MVR Mitral Valve Replacement. NA Sodium. NABS Normoactive Bowel Sounds. NAD No abnormality detected. No apparent distress. NAS No added salt. NB Newborn. Note well. NBN Newborn Nursery. NBTE Non-bacterial thrombotic endocarditis. NC Nerve action potential. Nasal cannula. NCC Non-compaction cardiomyopathy. NCS Nerve conduction study. NCT Nerve conduction test. NCV Nerve conduction velocity. ND, examination, not done. NE norepinephrine. NE neutrophil granulocytes. NEC not elsewhere classified. NEG negative. Neoneoplasm. NES not elsewhere specified. NFR not for resuscitation. NGT nasogastric tube. NGU non-gonococcal urethritis. NHL non-Hodgkin lymphoma. NICU neonatal intensive care unit. NIDDM non-insulin dependent diabetes mellitus. NK natural killer cells. NKA no known allergies. NKDA no known drug allergies. NL normal. NLP no light perception. NM nuclear medicine. NMR nuclear magnetic resonance. NNH number needed to harm. NNT number needed to treat. No nitric oxide. No. Number. NOF neck of femur. Non-rep. Do not repeat. NOS nitric oxide synthase. Not otherwise specified. NPH normal pressure hydrocephalus. NPL neoplasm. NPO nil per OS, nothing by mouth. NPTEC no previous tracing available for comparison. NRB non-rebreather mask. NRBC nucleated red blood cells. NREM non-rapid eye movement. NS. Not significant. NS normal saline. NSA no significant abnormality. NSAID nonsteroidal anti-inflammatory drug. NSCC non-squamous cell carcinoma. NSCLC non-small cell lung cancer. NSD normal spontaneous delivery. NSE neurospecific enolase. NSR normal sinus rhythm. NST non-stress test. NSTEMI non-ST elevation myocardial infarction. NSU non-specific urethritis. NT not tested. NTG nitroglycerin. NTT nasotracheal tube. NNV nausea and vomiting. NVD normal vaginal delivery. NVDC nausea, vomiting, diarrhea, and constipation. O nothing. O2 oxygen. OA osteoarthritis. OBGYN obstetrics and gynecology. OBL oblique. OBS organic brain syndrome. OCC occasional. OCD obsessive compulsive disorder. OCG oral cholecystogram. OCNA old chart not available. OCP oral contraceptive pill. Optical coherence tomography. OD overdose. Occupational disease. OE otitis externa. O/E on examination. OGTT oral glucose tolerance test. Oral hairy leukoplakia. Ointment. OM otitis media. Otitis media with effusion. OOB out of bed. OP outpatient department. ONP ova and parasites. OPD outpatient department. OPPT oriented to person, place and time. OPV outpatient visit. Or operating room. ORIF open reduction internal fixation. ORSA oxacillin resistant Staphylococcus aureus. Oral rehydration therapy. OS orthopedic surgery. OSA obstructive sleep apnea. OSH outside hospital. Osmolarity. Osteomyelitis. OT occupational therapy. ODC over the counter. OTD out the door, discharged. OTPP oriented to time, place and person. OV office visit. Ounce. P parturition. Phosphorus. Pulse. Post. Posterior anterior. Postero-anterior. Pulmonary artery. Physician assistant. PNA percussion and auscultation. PAC, premature atrial contraction. Pulmonary artery catheter. Pulmonary artery catheterization. PAD peripheral artery disease. PAF platelet activating factor. Paroxysmal atrial fibrillation. PA pulmonary arterial hypertension. Phenylalanine hydroxylase. PI1 plasminogen activator inhibitor 1. PAL posterior axillary line. PALS pediatric advanced life support. PAN polyarteritis nodosa. PAO peak acid output. PAOD peripheral artery occlusive disease. PAP Papanicolaou stain. Positive airway pressure. Pulmonary artery pressure. PAP Papanicolaou test, PAP smear. PARA 2 indicating a woman with 2 children. PAT paroxysmal atrial tachycardia. PBF peripheral blood film. PCA patient-controlled analgesia. PCA prostate cancer. PCD post-concussional disorder. Primary ciliary dyskinesia. PCI percutaneous coronary intervention. PCL posterior cruciate ligament. PCN penicillin. PCNSL primary CNS lymphoma. PCOS polycystic ovarian syndrome. PCP pneumocystis carinii pneumonia. Primary care physician. Primary care provider. PCR patient care report. Polymerase chain reaction. PCS post-concussion syndrome. PCV packed cell volume. Polycythemia vera. PCWP pulmonary capillary wedge pressure. PD, Parkinson's disease. Peritoneal dialysis. Physical diagnosis. PDA, patent ductus arteriosus. Posterior descending artery. PDE phosphodiesterase. PDGF platelet-derived growth factor. PDR Physician's Desk Reference. PDT Photodynamic Therapy. PE, Pulmonary Embolism. Physical Examination. Preeclampsia. P. Pulseless electrical activity. PEEP positive end expiratory pressure. PEF peak expiratory flow. PEFR peak expiratory flow rate. PEG percutaneous endoscopic gastrostomy. Penicillin. PEP post-exposure prophylaxis. Pearl pupils equal, round, reactive to light. Perla pupils equal and reactive to light and accommodation. Perla pupils equal, round, reactive to light and accommodation. Pervag pervaginum. PET positron emission tomography. PFO patent foramen ovale. PFT pulmonary function test. PGCS pediatric Glasgow coma scale. pH pulmonary hypertension. PHX past history. PHTLS pre-hospital trauma life support. PI present illness. PIC peripherally inserted central catheter. PID pelvic inflammatory disease. Prolapsed intervertebral disc. PIH pregnancy-induced hypertension. PIP proximal interphalangeal joint. PKA protein kinase A. PKD polycystic kidney disease. PKU phenylketonuria. Plat tissue plasminogen activator. PLIF posterior lumbar interbody fusion. PLT platelets. PM post-meridiem. In the afternoon. PMB postmenopausal bleeding. PMH past medical history. Perimesencephalic subarachnoid hemorrhage. PMI point of maximal impulse or apical beat. Point of maximal intensity. PML polyomavirus. PMP pseudomyxoma peritonia. PMN polymorphonuclear leukocytes. PMR percutaneous myocardial revascularization. Polymyalgia rheumatica. PMNR physical medicine and rehabilitation. PND paroxysmal nocturnal dyspnea. Postnasal drip. PNH paroxysmal nocturnal hemoglobinuria. PNM perinatal mortality. POD postoperative days. Post-posterior. POX peroxidase. PP pulse pressure. Postpartum and postnatal. PPCS prolonged post-concussion syndrome. PPD, packs per day, cigarettes. Postpartum depression. Postnatal depression. Purified protein derivative. PPH, postpartum hemorrhage. Primary pulmonary hypertension. Procedure for prolapse in hemorrhoids. PPI proton pump inhibitor. Preterm premature rupture of membranes. PPS post-polio syndrome. PPT precipitate. PPTL postpartum tubal ligation. PR prothrombin ratio. PR. Per rectum. PRA plasma renin activity. PRBC packed red blood cells. Premature infant. Premature birth. Preparation. Prolonged reversible ischemic neurologic deficit. PRN as needed. Prognosis. Premature rupture of membranes. PRP panretinal photocoagulation. Progressive rubella panencephalitis. PRV polycythemia rubra vera. PSA prostate-specific antigen. PSGN post-streptococcal glomerulonephritis. PSH psychosocial history. Past social history. PSP phenylsultaline. PSS progressive systemic sclerosis. PT prothrombin time. Physical therapy. PDA percutaneous transluminal angioplasty. Post-traumatic amnesia. Prior to admission. PTB pulmonary tuberculosis. PTC percutaneous transhepatic cholangiography. PTCA percutaneous transluminal coronary angioplasty. PTD prior to discharge. PTH parathyroid hormone. PTHC percutaneous transhepatic cholangiography. PTSD post-traumatic stress disorder. PTSS post-traumatic stress syndrome. PTT partial thromboplastin time. PTX pneumothorax. PUD peptic ulcer disease. PUO pyrexia of unknown origin. PUVA serolin UVA. PVC premature ventricular contraction. PVD peripheral vascular disease. PVFS post-viral fatigue syndrome. PVR pulmonary vascular resistance. PVS persistent vegetative state. Pulmonary valve stenosis. Plummer-Vinson syndrome. PWP pulmonary wedge pressure. PX physical examination. Prognosis. QALY quality adjusted life year. QNS quantity not sufficient. RA, refractory anemia. Rheumatoid arthritis. Right atrium. RAD reflex anal dilatation. Right axis deviation. Reactive airway disease. RAD Heiss radical hysterectomy. RI radioactive iodine. RAPD relative afferent pupillary defect. RAS renal artery stenosis. RBBB right bundle branch block. RBC red blood cells. Red blood count. RBLM recurrent benign lymphocytic meningitis. RCA right coronary artery. RCC renal cell carcinoma. RCM restrictive cardiomyopathy. Right costal margin. RCT randomized controlled trial. RD retinal detachment. RDS respiratory distress syndrome. RDW red cell distribution width. REM rapid eye movement. RF rheumatoid factor. Rheumatic fever. RFLP restriction fragment length polymorphism. RFT renal function test. R/G/M rub/gallops/murmurs. RH rhesus factor. RHD rheumatoid heart disease. RHF rheumatoid factor. RIA radioimmunoassay. REBA radioimmunoblotting assay. RICE rest, ice, compression, and elevation. REMA reversible inhibitor of monoamine oxidase A. RIND reversible ischemic neurologic deficit. RL Ringer's lactate. RLE right lower extremity. RLL right lower lobe. RLN recurrent laryngeal nerve. Regional lymph node. RLQ right lower quadrant. RML right middle lobe. RNA ribonucleic acid. RNP ribonucleoprotein. RNV radionuclear ventriculography. ROM range of motion. R/O rule out. ROA right occipital anterior. ROP right occipital posterior. ROS review of systems. ROSC return of spontaneous circulation. RPGN rapidly progressing glomerulonephritis. RPR rapid plasma reagent test. RR respiratory rate. RRR regular rate and rhythm, pulse. R cell Reed-Sternberg cell. RSI rapid sequence induction. RSV respiratory syncytial virus. RT respiratory therapy. Reverse transcriptase. RT-PCR reverse transcriptase polymerase chain reaction. RTA renal tubule acidosis. RDC return to clinic. RTS revised trauma score. RU right upper extremity. RUL right upper lobe. RUQ right upper quadrant. RV residual volume. Right ventricle. RVAD right ventricular assist device. RVF right ventricular failure. RVH right ventricular hypertrophy. RVSP right ventricular systolic pressure. RVT renal vein thrombosis. RX prescription drug. SX symptoms. S1 first heart sound. S2 second heart sound. SA sinoatrial node. SAB, staphylococcal bacteremia. Spontaneous abortion. SAH subarachnoid hemorrhage. SAN sinoatrial node. SAPS simplified acute physiology score. SARS severe acute respiratory syndrome. SB small bowel. SBE subacute bacterial endocarditis. SBO small bowel obstruction. SBP systolic blood pressure. Spontaneous bacterial peritonitis. SCC squamous cell carcinoma. SCD sudden cardiac death. SCLC small cell lung cancer. SCID severe combined immunodeficiency. SDH subdural hematoma. SEM systolic ejection murmur. SIRT serotonin transporter. SFA superficial femoral artery. Serum folic acid. SGA small for gestational age. SGOT serum glutamic oxalotic transaminase. SGPT serum glutamic pyruvic transaminase. SG cath Swan-Ganz catheter. SHX social history. Surgical history. SHBG sex hormone binding globulin. SI international system of units. Suicidal ideation. Seriously ill. SIAD syndrome of inappropriate antidiuretic hormone. 6 surgical intensive care unit. SIDS sudden infant death syndrome. SIMV synchronized intermittent mechanical ventilation. SIT stress inoculation training. SK streptokinase. SL sublingual. SLE systemic lupus erythematosus. SLEVST. Lewis virus. SLR straight leg raise. SLL small lymphocytic lymphoma. SM sclerosis multiplex. SMA sequential multiple analysis. Superior mesenteric artery. SMA-7 serum metabolic assay. SMS senior medical student. SMT spinal manipulative therapy. SMV superior mesenteric vein. SN student nurse. SNB sentinel node biopsy. SNP sodium nitroprusside. Single nucleotide polymorphism. SNRI serotonin norepinephrine reuptake inhibitor. SNV Syn-Nombre virus. SOAP subjective, objective, assessment, plan. SOB shortness of breath. SOBO short of breath on exercise. Soul space occupying lesion. Soul solution. SOOB send out of bed. SOS save our souls. S/P status post. SPECT specimen. SPECT single photon emission computed tomography. SPEP serum protein electrophoresis. SPET single photon emission tomography. SP fluid spinal fluid, cerebrospinal fluid. SPGR specific gravity. SQ subcutaneous. SR slow release. SROM spontaneous rupture of membranes. SRS stereotactic radiotherapy. SS sickle cell disease. SSPE subacute sclerosing panencephalitis. SSRNA single-stranded RNA. SSRI selective serotonin reuptake inhibitor. SSSS staphylococcal scalded skin syndrome. SSS sick sinus syndrome. Staphylococcus. STD sexually transmitted disease. STAT shortest turnaround time. STEC Shiga toxin producing Escherichia coli. STEMI ST elevation MI. STH somatotropic hormone. ST sexually transmitted infection. Soft tissue injury. STNR symmetrical tonic neck reflex. Stop surgical termination of pregnancy. Streptococcus. STS serological test for syphilis. Subcutaneous. Subsuppository. SUV standard uptake value. SV seminal vesicle. Stroke volume. SVC superior vena cava. SVD spontaneous vaginal delivery. Simple vertex delivery. SVI systemic viral infection. SVN small volume nebulizer. SVR systemic vascular resistance. SVT supraventricular tachycardia. SX surgery. Symptoms. SXA single energy X-ray absorptiometer. SXR skull X-ray. SZ seizure. TX transplantation. Traction. TNA tonsillectomy with adenoidectomy. TAB tablet. TAB therapeutic abortion. TA total abdominal hysterectomy. BSO bilateral salpingo-oophorectomy. TB tuberculosis. TBC total body crunch. TBI total body irradiation. Traumatic brain injury. TBLC term birth living child. TC traffic crash. TCC transitional cell carcinoma. TCN tetracycline. TCT thrombin clotting time. TD tetanus and diphtheria. TEB thoracic electrical bioimpedance. T transesophageal echocardiogram. TEM transmission electron microscopy. Temp temperature. TENS transcutaneous electrical nerve stimulator. Turn in turn. TF transfer. TFT's thyroid function tests. TGA transposition of the great arteries. TG triglycerides. TG thyroglobulin. TGF tumor growth factor. TGV transposition of the great vessels. THR total hip replacement. TIA transient ischemic attack. TIBC total iron binding capacity. TIN tubulointerstitial nephritis. TIPS transjugular intrahepatic portosystemic shunt. TKR total knee replacement. TKO to keep vein open for 4 therapy. TKVO to keep vein open. TLC total lung capacity. Tender loving care. TLR tonic labyrinthine reflex. Trademark tympanic membrane. TME total mesorectal excision. TNF tumor necrosis factors. TMJ temporomandibular joint. TNG trinitroglycerin. TNM tumor nodes metastases. TOA tubo-ovarian abscess. TOD transesophageal Doppler. TOE transesophageal echocardiogram. TOF tetralogy of Fallot. Top termination of pregnancy. TP total protein. TPA tissue plasminogen activator. TPN total parenteral nutrition. TPR temperature, pulse, respiration. TR tricuspid regurgitation. TR tincture. TRAM transverse rectus abdominis myocutaneous flap. TRAP tartarate resistant acid phosphatase. TRF transfer. TRFD transferred. TRH thyrotrophin releasing hormone. TS tricuspid stenosis. Teaspoon, 5 ml. TSH thyroid stimulating hormone. TSTH2 sick to send home. TT thrombin time. TTE transthoracic echocardiogram. TTO to take out. TTP thrombotic thrombocytopenic purpura. Tender to palpation. TTR transthyretin. TDS transdermal therapeutic system. TTTS twin-to-twin transfusion syndrome. 2 tumor. TURB transurethral resection of bladder tumor. TURB transurethral resection of the prostate. TVH total vagina hysterectomy. TX transplant. Treatment. UA urinalysis. UBT urea breath test. UC ulcerative colitis. UCHD usual childhood diseases. UDS urine drug screening. UE upper extremity. UNE urea and electrolytes. UIP usual interstitial pneumonitis. UGI upper gastrointestinal. UOP urinary output. UNC unknown. UPJ ureteropelvic junction. URA unilateral renal agenesis. URI upper respiratory infection. URTI upper respiratory tract infection. USG ultrasonogram. USR unheated serum reagent. USS ultrasound scan. UTI urinary tract infection. UVAL ultraviolet argon laser. V. Ventilation. VA Visual Acuity. VAD Ventricular Assist Device. Vincristine Adriblastin Dexamethasone. VAG Vaginal. VAMP Vincristine Adriblastin Methylprednisone. VBAC Vaginal Birth After Caesarean. VC Vital Capacity. VCJD Variant Creutzfeldt-Jakob Disease. VD Venereal Disease. Vaginal Delivery. VDRF Ventilator Dependent Respiratory Failure. VE Vaginal Examination. V. Venezuelan Equine Encephalitis. VEB Ventricular Ectopic Beat. VF or VFib Ventricular Fibrillation. VIP Vasoactive Intestinal Peptide. VLDL Very Low Density Lipoprotein. VMA Vanillomandelic Acid. Violent Mechanical Asphyxia. VNPI Van Naas Prognostic Scoring Index. VO Verbal Order. VOD Volume of Distribution. VPA Valproic Acid. VPAP Variable Positive Airway Pressure. VPB Ventricular Premature Beats. VPC Ventricular Premature Contraction. V/Q Ventilation/Perfusion Scan. VRE Vancomycin Resistant Enterococcus. VRSA Vancomycin Resistant Staphylococcus aureus. VS Vital Signs. VSS Vital Signs Stable. VSD Ventricular Septal Defect. VSR Ventricular Septal Rupture. VT Ventricular Tachycardia. Varotoxin. VTE Venous Thromboembolism. VTEC Varotoxin Producing Escherichia coli. VUR Vesicoureteral Reflux. VZV Varicella Zoster Virus. W/with. WAP Wandering Atrial Pacemaker. WAT White Adipose Tissue. WBC White Blood Cell. WBRT Whole Brain Radiotherapy Treatment. W/C Wheelchair. WD Well Developed. WDL Within Defined Limits. WH Well Hydrated. WDWN Well Developed and Well Nourished. We Western Equine Encephalitis Virus. WG Wegener's Granulomatosis. WN Well Nourished. WNL Within Normal Limits. W/O Without. WPW Wolff Parkinson White Syndrome. WT Weight. WS, Waardenburg Syndrome. Warkany Syndrome. Water-soluble. Werner Syndrome. West Syndrome. Williams Syndrome. Wolfram Syndrome. WWI Walking While Intoxicated. XR X-ray. Yo years old. ZD Zinc Deficiency. ZIFT Zygote Intrafallopian Transfer. Or. Ear. Or. Dextro. To right ear. Or. Left to left ear. OD right eye. OS left eye. OU both eyes. S without. TDS or TID. 3 times a day. Q each, every. QD. Each day. QAD. Every other day. QDS. 4 times each day. QH. Each hour. QHS. Every bedtime. QID. 4 times each day. QL. As much as you like. QMT. Every month. QN. Every night. QOD. Every other day. QOH. Every other hour. QS. As much as suffices. QT quart. QV. Which C. As much as you please. QWK weekly. OM or Q.AM every morning. On every night. AH. Every other hour. Altern. D every other day. BID. Twice a day. OD every day. UD as directed. Ointment. PC. After food. After meals. AC or AP. Before a meal. AQ. Water. AQ bowl. Boiling water. AQ colid. Warm or hot water. AQ dist. Distilled water. AQ gel. Cold water. PO by mouth, orally. Orist. Eardrops. Application. To be applied. HS. At bedtime. SC subcutaneous.